A warm welcome, dear students. This is a strategy for NEET PG 2024 video. We are in July of 2023 and this is the time when most of the states have completed their internship and students are freshly about to begin their serious NEET PG preparation. Until now, you might be doing certain subjects in a haphazard way, not being able to give your full capacity because of the internship. But this is the time when you are going to begin your complete, serious, strategic preparation for NEET PG 2024. And this is also for anybody who has given up their preparation in between due to some reason and are about to start again. So in this video, I'm going to cover all the topics necessary for the exam, such as in which order to follow, which subject should be done before and which subject should be done later, what are the high yield subjects, and the order of topics in each subject and the number of days to be given for each subject also in a complete detailed manner, along with so many bonus tips, tricks and strategies. So make sure you watch the video till the end. And this is complete NEET PG preparation video. This is not a revision video. So the number of days I'm going to give and all of them are for people who are beginning it for the first time. It is suitable for anybody who is beginning their preparation from the scratch. And if you are even halfway, you can use this as a guide and make certain modifications to suit your own preparation, okay? Because certain points are very, very crucial. I'll tell you, for example, where students go wrong. Most of us think medicine is a very important subject and that's huge and it has to be done. But if you start your preparation with medicine without having a sound understanding of pathology and physiology, medicine alone would take 6 months to complete, to be able to do it in that fashion. So it's important that you decide your order of subjects and order of topics very, very properly. And you should also know the time that has to be given for each subject. So this is going to be a study planner video that is beginning from July 20th. And I will give you a plan till November 30 to finish your first time reading, and December will be for revision. And meanwhile, you will also get the exact date of NEET PG 2024 and that will allow you to navigate things better. So without any further delay, let us first begin with the study planner. Okay? So we are starting our NEET PG preparation journey with physiology. And this strategy is very, very unique. It's not like doing one subject after the other. You're going to do it in bits and pieces in a way that is most efficient and effective to remember, and that's also easy for your brain to adopt to things, okay? So we are beginning our preparation with physiology, and you will take only 2 days to do physiology, and you will also cover only 2 topics in these 2 days. On the first day, you will do general physiology, and on the second day, you will do nerve muscle physiology. And then you will stop physiology. Now you might ask me, ma'am, what about other topics such as CNS, CVS, respiratory, GIT? I'm writing all the list for you beside, and you will eventually understand when you will do each one of them, okay? Endocrinology and reproductive. CNS, CVS, respiratory, GIT, renal, endocrine, repro and also hematology. You will do them when required. So physiology you will do only for 2 days and then move to biochemistry. In biochemistry, first day you will do general biochemistry. Learning about the fed state, fasting state and all those principles of biochemistry plus enzymology. You will do these 2 for 1 day. Next, you will do carbohydrates. For 2 days, carbohydrate chemistry plus metabolisms and also the disorders. After carbohydrates, you will do vitamins. Now, after studying chemistry and metabolisms for a while, you cannot immediately shift to lipids and again do lipid chemistry metabolism and then move to protein, do protein chemistry and metabolism. That will be too strenuous for the mind. So, I have divided it in such a way that it's easy for you to shuffle between topics. After doing something like carbohydrates, go for vitamins, which are relatively easy but also very, very important. If somebody asks me what is one thing that I must do in biochemistry, I would say vitamins. Okay. Apart from the disorders, your sphingolipidosis, glycogen storage disorders, lysosomal storage disorders rank number 1 and vitamins number 2. I am telling number 2 because vitamins are also partly covered in pediatrics and SPM. Alright. So, after carbohydrates, you will do vitamins and then you will again go back to your chemistries and metabolisms of lipids. Okay. And after that, you will do molecular biology. After molecular biology, again coming back to chemistries and metabolism of proteins and amino acids. And finally, on the last day, you will do bioenergetics, your bioenergetics of Krebs cycle and all those stuff, and anything that you have missed in these previous days. Anywhere if you could not complete the target on the given day, there you will utilize this time on the last day because bioenergetics would hardly take 1 or 2 hours, okay? And the rest of the day is for revision of the entire thing, not exactly revision, to complete everything, okay? So, how many days have we given for biochemistry? I'm sorry, carbohydrate, 1 day. 1 day for all of them. That would make it 3, 4, 5, 6, 7 days for biochemistry. You have one total week to study biochemistry and that is absolutely enough even if you're beginning from the scratch, okay? So, we have done 2 days of physiology and then we have moved to biochemistry. After biochemistry, we will move to a clinical subject, that's ENT, that's also short and sweet to complete. It's quick and fast and that will also give you satisfaction of completing one subject, okay? So, in ENT, you will begin with ear. On the next day, you will do larynx plus pharynx. And on the third day, you will do nose plus any miscellaneous stuff. When I say miscellaneous, what I mean is you're supposed to do images, all the images together and anything that you have missed. Suppose surgeries, some people do not complete along with the ear diseases and laryngeal surgeries are not done along with laryngeal diseases. So, for all those things, you're supposed to do on the last day and complete the subject. And by chance you couldn't complete anything on the previous days, everything has to be winded up on the last day. And then after doing ENT, we will do anatomy, not complete. Anatomy is also broken at regular intervals. Because anatomy, even if you study the entire anatomy for 1 week, people can do neuroanatomy alone for all 7 days and still feel not enough. Okay. So, anatomy if done at a stretch could be very overwhelming and it will eventually give you a feeling that you have forgotten everything. And by the way, when we are moving towards next, although you are writing NEET, questions are becoming more and more clinical. So, it's essential that you integrate anatomy to the relevant subject wherever needed. After studying ENT, your knowledge of head and neck anatomy would anyhow become better. So, immediately after ENT, for 2 days you will do anatomy. What you will do is head and neck anatomy. Head and neck, and on the second day you will do thorax. Alright, so we have given 3 days for ENT and 2 days for anatomy here. Okay, 3 days for ENT, 1 day for ear, 1 day for larynx and pharynx, and third day nose plus winding up of the subject. In 2 days we have done little of anatomy, head and neck plus thorax. And then let us move on to dermatology. Dermatology should take you 2 days. I am not subdividing dermatology because you can do it the way you want. Although I would suggest keep 1 day for all infections, bacterial infections, fungal infections, viral, tuberculosis of the skin, and most important, STDs. And on the second day, you can do all other disorders such as pigmentary disorders, appendigeal disorders, the disorders of hair and nails, and all those things on the second day. Pemphigus, all your vesicobilous disorders, everything on 1 day. The rest of derma on 1 day, infections on 1 day. That would be a fair division. So, you can easily complete dermatology in 2 days. Then again, after doing 2 small subjects, let us move on to something big, heavy and important, and that is pathology. While doing pathology, First, you must start with general pathology. General pathology. Take 2 days for general pathology. And most important in general pathology is to solve questions. I would recommend first solve questions and then study general pathology, even though you are unable to answer anything. Because when you are studying general pathology, it's very hard to predict what kind of question can be asked. I mean, you're studying, say, inflammation, the process of inflammation or something in genetics. Everything looks as if it's very simple and basic, and how can a question even be framed from such a topic? That is the feeling anyone would get when they're studying general pathology. So first look at the questions and then start studying general pathology. You can complete general pathology in 2 days. Pay a lot of focus on genetics and neoplastic disorders, all the basics of neoplasms and everything, okay? And then we will move on to hematology. In hematology, what you're supposed to do is, the first 2 days, total you have to take 4 days for hematology. In those 4 days, the first 2 days, what you will do is physiology, part of hemat plus RBCs. Now remember, when we were doing physiology, we only did general physio, nerve, muscle and left it there. Hematology, you have to do it now. Open your physiology book and open the hematology chapter, do hematopoiesis, all those basic structures, counts, normal values, everything in hemat, and then come to pathology and start with RBCs. You have to do all your anemias, iron deficiency anemia, nutritional anemias and hemolytic anemias. Now, hemolytic anemias are slightly more difficult than iron deficiency and megaloblastic and also very important. Thalassemia, all types of hemolytic anemias are also important. Very important, and they're slightly new because while doing during your MBBS days, somehow usually people skip through those hemolytic anemias part, okay? So pay special attention on hemolytic anemias. And on the second day you will do, the second part, for the next 2 days, you will do WBCs plus platelets. It's a fair enough time to complete WBCs and platelets. All lymphomas and leukemias have to be done, and even platelets are important, okay? So all in all, we have got 4 days for hematology. Now, as I told you, this is for people who are doing it for the first time, and it's fairly enough. This is not a revision timetable, please understand. And that is why you're getting so many days for pathology, okay? And after doing general path plus hematology, usually people will get saturated and will want to switch to another subject instead of completing pathology. So then I've given a short break in the sense, a small deviation. Do psychiatry for 2 days, okay? Do psychiatry for 2 days. Psychiatry is a easy subject on the mind. It's not very loading. It's not very strenuous. So you can easily complete psychiatry in 2 days and even take some small rest actually. Okay. So you will do psychiatry for 2 days and then come back to pathology again. And this time we are doing systemic pathology. While doing systemic pathology, what you will do is, you will start with CVS. You will take 1 day for CVS and then you will go to respi. When you're doing respiratory system, what you have to do is, first day, you have to do physiology. Again, open your physiology book and study respiration. And on the second day, do the respiratory from pathology. I'm telling you, doing it this way will definitely make things easy for you. When you study respiratory system from the scratch, all the basics in physiology and then move to pathology, it will be very, very easy to understand all your restrictive lung diseases, obstructive lung diseases, what is the difference and all will be nicely explained in physiology. Now, if you study all this long back, it will still be difficult to correlate when you're doing pathology, and not doing physio and directly moving to path is also a very bad idea, okay? So, do physiology first day and then pathology the second day. So, all in all, you are giving 2 days for respiratory system. And then move to GIT plus liver. GIT plus hepatology. Here also you are doing physio plus path. Physio part of GIT is very, very simple and easy. There's not much to be done. You can complete it in half a day. But I'm still giving you 2 days because GIT in pathology is very big and huge. You're studying everything from the esophagus till the end with all types of carcinomas and everything. I know it's long. So take 2 days plus hepatology also. So 1.5 day will be for pathology and half a day will be for physiology. Then move to kidney. You're doing only pathology part in kidney because the physio understanding is not very much required for path understanding of kidney. Because here you're mostly dealing with all the histopathological images, amyloidosis, renal amyloidosis and so many other renal diseases which are more at the histopath level than at the physiological level. Okay, so you need not do any previous subject. Directly go with the kidney of pathology and take 2 days. Why 2 days? Because it's very important. A question from renal pathology is usually asked. So take 2 days, study it properly and understand. Okay, and pay special attention to the images. Images are very important here. So this is how you're going to do kidney and then move to reproductive pathology. When I say repro, what I mean is all your testes, ovarian, prostate and the entire female genital tract. Ovaries, fallopian tube pathology, in uterus also you will study a few. Everything has to come. Along with this, you should also do breast. Reproductive pathology plus breast. This will also take 2 days. Then on the next day, you will do endocrine. Most important being your thyroid disorders. Plus you will also do CNS. Now CNS and path is very small and simple. You just have to learn about a few carcinomas and few other diseases. It's small, it will get done. 2 days for this. 1 day say for endocrine and 1 day for CNS. And finally again I'm giving you 1 more day to complete any miscellaneous stuff plus backlogs. When I say miscellaneous, most importantly in pathology, I expect you to go through all the histopathological images once. Histopathological images of hematology are very important and those of systemic are also important. So on the last day, you will go through all the images. And now completely for pathology, how many days have we got? 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 days I'm giving you for pathology. 18 days to complete pathology. 18 days is fairly a good enough time even if you're beginning. Usually in revision they give 4 or 5 days for pathology. Because you're doing it for the first time, I've given 18 days and that too if you cannot do it in a stretch, after general path and hematology, take a break and do psychiatry for 2 days. If you are comfortable doing it at a stretch, complete pathology for 18 days and then do psychiatry for 2 days. It's absolutely up to you, okay? After doing a heavy subject like pathology again, even if you do psychiatry, it's recommended that you do some small subjects, okay? So psychiatry and forensic medicine. Forensic also can be done in 2 days. 2 days for forensic medicine and toxicology. On the first day you will do forensic medicine and on the second day you will do toxicology. 1 plus 1, 2 days. Then again let's move on to our paraclinical subjects. We will do microbiology. Now the order of topics in microbiology is very important. Usually when I say micro, people will start with bacteriology and by the time you complete Staphylococcus aureus only NEET PG 2024 will come. Okay. So never do that mistake. Do not start microbiology with bacteriology. This mistake has been committed by hundreds of people and hundreds of people could not complete microbiology just because of this one thing. So please do not start microbiology with bacteriology. First, I'll tell you, begin with virology. Okay. And in virology also, first you have to get that basic chart right. Okay. What are DNA viruses? What are RNA viruses? What are enveloped, non-enveloped? What are single-stranded? What are double-stranded? Shapes of viruses. All that basic information you must have. And then go on to study the diseases. So you can complete virology in 1 day. After that, do parasitology. Now, questions in microbiology are not asked just from bacteriology, okay? They're asked from virology, parasitology and so many other things also, and parasito is very important, okay? So, take 1.5 day for parasitology because that's again into 2 parts. Protozoa are also there and helminths are also there. So, take 1.5 day. And do not spend a lot of time on life cycles, okay? You need not by heart the life cycle. If you are well versed with what is the primary host, intermediate host and broadly about the parasite, when you look at the life cycle, you can actually automatically deduce which organism's life cycle is that, okay. So do not spend too much time on life cycles, understand each one of them properly and then randomly, solve a few questions pertaining to life cycles and you will be able to solve them, okay. After parasitology, do fungi. Mycology. Mycology is very, very small, you can complete it in half a day. And then go to general microbiology. What will you study in general microbiology? All those, general microbiology is actually general bacteriology only. That will give you an idea about culture plates, culture methods, a few scientists and all. Take one day for general microbiology. Why I am giving one full day for such a small topic? Because there are some very, very important topics like sterilization and waste management, biomedical waste management. Both of them, usually one question is asked in every exam from these two topics. So study them with a lot of interest and focus, and if possible make some sticky notes and put it on your wall. Sterilization techniques and waste disposal, okay. So take one day for general micro, and then now you have to come to bacteriology. By the time you come to bacteriology, you will be well versed with how to study micro, where to skip, what to study, how to remember, because virology, parasitology are relatively manageable in terms of memory also. Bacteriology, if you start with bacteriology, by the time you do 3 or 4 bacteria and come to the 5th one, you'll feel you've forgotten the first one. All this feeling and adjusting to microbiology will happen very nicely if you start with virology and parasitology. And then you have to come to bacteriology and complete bacteriology in 2 days. How much ever it will happen, it will happen. Wind it up in 2 days. If possible, start with PYQs only. Look at a PYQ and study. Suppose you are answering a question in cholera, open Vibrio cholera and study all of that. Then you start answering a question on Staph aureus, open Staph aureus and study all that. At the end, after doing all the PYQs, then look at the entire bacteriology in one glance. You will see that you have completed at least 50 to 70% of it. The other 30% then just go through. Okay, that's how you can complete bacteriology in 2 days. Then on the last one day, do immunology. Immunology is partly repetitive in general path plus microbiology. So one day will be more than enough for that. Actually, half a day is enough. The rest half a day is to complete any backlogs. Plus, you have to focus on images. The images of microbiology are very, very important. Okay, to identify the eggs, to identify culture plates, all of them are important. So on the last day, you will do immunology, complete any backlogs if you have, plus look at the images. This will take one day. So all in all, I have given one full week for microbiology. Okay. This is quite a broad timetable that will even allow you to rest for a while and do. After every big subject, I am usually giving you the last day for backlogs so that nothing is left out when you are moving to the next subject. Okay. After doing microbiology, then you have to do community medicine. Okay. I'll tell you how that helps. While doing community medicine, first start with health and disease. Health and disease, the first chapter, where you will have all the levels of prevention, epidemiological triangle, everything. Okay. Health and disease you can complete in half a day. And then you will do demography plus family planning plus sociology plus disaster management. All these are small topics you can complete in the rest half. So by the time you're done with one day of SPM, you would have covered 5 topics: demography, family planning, sociology, disaster management and health and disease. A good chunk of questions. And then on the second day, you will do epidemiology. Epidemiology is big and important and conceptual. So one full day for epidemiology. Okay, not even any small topic along with it. Then on the next day, you will do screening. Screening is a good, it's big but not too big also. Screening actually is small, but you will have to take time to solve questions in screening. All those sensitivity, specificity questions and what is true positive, true negative and positive predictive value, negative predictive value. Please sit and practice questions from them. Okay, so for that it will take a little more time, but still you can accommodate 2 small topics, and they are Communication in health. Communication in health, you just have to read once and you'll be done with that. You know, all those methods of communication, didactic, group communication and everything. It's just a one-time read topic and you'll be done with that. And then you can also do international health. On the third day, you will do these topics. Then move to biostats. Now, when you're doing screening itself, slowly some of your math, arithmetic skills will come up to the surface. In that flow, do biostats. Biostats one full day, okay, for you to understand and solve everything. Then come to communicable diseases. When you're doing communicable diseases, you also have to do a revision of microbiology. Because now you're so much into SPM, slowly if you look back, that feeling that I have forgotten microbiology will arise by this time. So when you're doing communicable diseases, take that as an opportunity and revise micro. Now when I say revise micro, you will not again systematically open the book and do it from the first page. No, not that way. Whatever disease you're doing in communicable diseases, open that particular part of microbiology. Suppose you're doing tuberculosis here. Open tuberculosis and microbiology and flip through those pages. That will give you a feeling that you have not forgotten and it will also serve as a reminder, okay? So you have to do these two in one day. After this, then move to NCDs, non-communicable diseases plus health programs, okay? Health programs are important, but I suggest do not do all of them together. Do a few health programs here, do it for one day, how many ever possible, and then stop there, okay? I'll tell you when else you can complete health programs. After doing this, again do small topics like nutrition. When you're doing nutrition, you have to go back and revise vitamins from biochemistry. This way you will open your biochem book in between and that will also help you revise that, okay? After nutrition, then do waste management. Then do genetics. When you're doing genetics, again you have to go to path and revise. Genetics part only. Path revision of genetics. Then after genetics, do occupational health, the ESI Act and all of that. After occupational health, do health care of community. When you're doing health care of community, again you can do health programs, a few health programs here also. All this on one day. Now it might appear too much, but it is actually possible. I'll tell you how. Waste management in half an hour. Genetics in 1 hour because you're revising path also. Nutrition 1 hour. Occupational health 1 hour. Healthcare of community 1 hour. 5 hours you can actually complete everything. Okay. So it's very much possible to do. Please do not skip the vitamins revision from biochem and path revision from genetics. Okay. Now this integration is the speciality of this timetable. So please follow that and make maximum utilization. Then on the last day of SPM, you will do obstetrics, preventive obstetrics, preventive pediatrics and preventive geriatrics. All on the last day. So how many days have we given for SPM totally? 8 days. 8 days for SPM because you're doing it for the first time. And while doing this, you're also revising micro a little bit. You're revising a little bit of path and biochemistry also. So with this, we are done with SPM. Then let us move on to OBG. Now on the last day of SPM, you have done preventive obstetrics, preventive pediatrics, and obviously reading them from SPM will not give you complete clarity and all those loose ends will be hanging in your mind, all those doubts, you know, maybe it is something different in obstetrics, things like that, and you will also get a small orientation into OBG. So immediately after SPM, go and utilize that in obstetrics and gynecology. Now the plan for OBG is very simple. I have divided it into 2 parts. I am giving you 10 days for OBG. First 5 days you will do obstetrics and the next 5 days you will do gynec. 10 days for OBG is a fair division, okay, 5 plus 5. Then after OBG, now we have again at a stretch done all these heavy subjects like micro, SPM, OBG. So let's again move to small subject. Do anesthesia. Anesthesia for 2 days. 2 days you will do anesthesia. First day you can do all the basic anesthesia, pre-operative management, anesthesia machine, monitoring of patient, circuits, airways, everything. And on the second day you can do all the drugs. Inhalational, IV, neuromuscular blockage drugs, regional anesthesia, all the drugs keep it on the second day and the rest of anesthesia on the first day. Or you can plan the way you want, but 2 days is enough to complete anesthesia, okay? Now you are anyhow doing the drugs of anesthesia, so in that continuum, go and do pharma, alright? So in pharma also the order of topics is slightly important. First begin with general pharmacology. General pharmacology. Take 1 full day to do that, okay? Then do autonomic nervous system. Without doing autonomic nervous system, please do not proceed into systemic pharmacology because in all systems usually there will be one category of drugs that are from the autonomic nervous system. So complete ANS first and do it conceptually, have a clear understanding about what is parasympathetic nervous system, what is sympathetic nervous system, what are the receptors in each one of them, what is adrenaline, noradrenaline, what is acetylcholine and everything, and then do ANS properly. ANS is a nice conceptual topic, do it properly. Then move to CVS. While doing CVS of pharmacology, what you have to do is take 2 days. On the first day you will do physiology, on the second day you will do pharmacology. To understand arrhythmias, what are tachyarrhythmias and how that cycle is stopping, what is the cardiac action potential and all those things, it's important to understand the physiology. So here we are doing physiology, CVS part of physiology on the first day and on the second day you will do pharma CVS drugs. So 2 days for CVS. Then do renal. Okay. Renal you will take only 1 day, but here also you have to complete physio plus pharma. Because pharma part of renal is very small. There's just diuretics. The most important part is diuretics. But to understand how diuretics are acting, what is a loop diuretic and all, you have to understand the basic physiology of nephron. Where reabsorption is occurring, where what is being secreted and all those things have to be freshly there in your mind to appreciate loop diuretics, potassium sparing diuretics and all that. So do physio and then do pharma. To properly do pharma renal part will just take 2 to 3 hours. But that physio understanding is very important. So you can still complete entire renal in 1 day in spite of doing physio part also, okay? Because the pharma part per se is small. And then on the next day, do some small topics like autocoids and then hemat part. Now people usually skip hematology in pharma, but it's important. There are just a few things, all those hematinics, iron containing drugs and all, they're important. Please do that and do not skip. And respiratory in pharma is also very small. Most important is bronchial asthma drugs and then antitussives and a few other miscellaneous drugs. And also GI. GI in pharma is also very simple. You just have antiemetics, antidiarrheal drugs and you're almost done with it. So all this can be done in 1 single day. Okay. Then move on to something that's very important and tricky, antimicrobials. Okay. Antimicrobials take 2 days. And while doing antimicrobials, again you have to revise micro. How you will revise micro? Bacteriology part micro revision is not necessary. But while doing viruses, fungi, antifungals, antiparasitic drugs, quickly go open microbiology once and compare, correlate and learn. Especially when you're doing drug of choices, open microbiology and see for each organism if you have got a drug of choice or not. Okay, drug of choice in antimicrobials is very important. So take 2 complete days for antimicrobials. And then move on to anti-neoplastic drugs. Anti-neoplastic drugs. Alright. With this, we will complete pharmacology. Anti-neoplastic drugs, you can do it in one day. Alright. And then on the last day, do CNS. And give one day for CNS to do the anti-epileptic medications and many other things. All CNS can be done in one day. So we have finally given 10 days for pharmacology. 1 day for general pharma, ANS. All topics can be done in one day except CVS and antimicrobials. Antimicrobials because it's huge, and CVS because you're doing physio part of CVS also. Now what did we leave here? We have left endocrinology. Endocrine part of pharma has not been done, and I'll tell you why, where it will be done. Okay. Next, after doing pharmacology, move to orthopedics. And when you're doing orthopedics, please start with general orthopedics. Your understanding of general orthopedics will help you with the treatment of almost everything, because first itself, if you understand what is conservative management, what is open reduction, closed reduction, what are the surgeries performed properly, the treatment of almost all fractures will become easy for you. And you have to get that basic orientation of types of fractures. Metabolic bone diseases are very important in general orthopedics. Okay, so please give one full day for general orthopedics and understand it properly. Okay, then you will do upper limb injuries for 2 days. Why 2 days just to do upper limb? Because you're doing enact. On the first day you will do enact completely, and on the second day you will do ortho part. Okay, you will first understand the entire upper limb anatomy. Now please remember, we have not so far given any dedicated day for enact. First time we have studied enact when? After ENT, we did the head and neck part. And now while doing orthopedics, you have to do upper limb, because the anatomy of upper limb is most useful to study orthopedics part. Okay, if you understand that properly, the fractures of upper limb will become very easy. Okay, so do enact for the first day, and on the second day move to trauma of upper limb. Then similarly you will do with lower limb also. For 2 days you will do lower limb. First day enact, second day ortho. Now when I say upper limb and lower limb, you are also doing nerve injuries. Nerve injuries also you are doing here, right? Nerve injuries also you can very nicely correlate with anatomy and orthopedics, because in both the subjects they will teach you nerve injuries. So do both of them and take 2 days for each. Alright, then after 5 days on the 6th day, move to other parts of orthopedics such as do spine, all the regional conditions, sports injuries, plus do pediatric orthopedics. That's important. CTEV, dislocation of hip, DDH, all of them are important. Take 1 day to do that. Then on the last day, you can do infectious conditions, osteomyelitis, tuberculosis, all of them are important. Joint disorders, and then tumors, bone tumors, plus images, and any miscellaneous stuff that you have left out. All this will take 1 day. So we have given 7 days for orthopedics, which is actually too much to study a small subject like orthopedics. But why did we take 7 days? Because in those 7 days, 2 days are actually going for anatomy. This correlation will save you a lot of time and mental burden also, because if you do anatomy long back, by the time you're doing ortho, you feel you have forgotten that entire anatomy, you do not know which nerve is supplying which structures and all. Doing it immediately will save a lot of mental energy. Okay, so please do it this way. And after doing orthopedics integrated with anatomy and all, go for another small short subject, that is ophthalmology. Ophthalmology can be completed in 4 days. I am not giving any further order in ophthalmology because topics are usually isolated, not much interrelation or correlation is there. You can just do it the way you want. But complete ophthalmology in 4 days. 4 days is also a lot, but because you are doing it for the first time, you can take 4 days without any guilt. Okay. Then let us move on to medicine, the final subject. Okay. Now until now, remember that we are done with the first year subjects. We are done with all second year subjects also. We are done with so many short subjects. Okay. Now let us move on to medicine, and please pay attention as to how you are doing medicine. Okay. First in medicine, you will begin with endocrinology. Now, endocrinology is the most important and doable part in medicine according to me, okay? Endo can nicely be understood, questions will also come and you can solve them also. So, start with endocrinology and give 3 days to do endocrinology. Why 3 days? Because the first day you are doing physio. You are studying endocrinology from physiology. And on the second day you are doing it from medicine. Then on the last day you will also do it from pharma. This order is important. First do physio part, then do medicine, last do pharma. Need not necessarily be one day. Maybe you can complete physio part in 1 day, take 1.5 a day for medicine and half a day for pharma. Now by the time you're doing pharma part, everything is almost very clear to you. You have understood the entire physiology, and by the time you come to medicine itself, your understanding is very clear. You can easily do the disorders in medicine. And then doing pharma will almost be a cakewalk. Okay, this is the reason we have avoided doing endocrine in pharma. Now endocrine part is also completed. So your entire pharmacology is done. Alright. So here we are doing endocrinology for 3 days. And then after endocrinology do hepatology and GIT. Hepatology plus GIT. I am giving you 2 days to do that. While you are doing hepatology and GIT, you must also revise path. When I say revise path, I mean do these 2 chapters from pathology also. First open your pathology book, go through GIT plus hepatology and then do those 2 topics from medicine. First you will go through GIT in pathology, then do GIT in medicine. Hepatology in pathology, hepatology in medicine. Now I am telling you, beginning from what you know and going towards the unknown will save a lot of mental energy, okay? So please follow this. You are taking 2 days for hepatology and GIT. Then come to rheumatology. Rheumat, when you are studying it for the first time, it appears very easy, logical, and it's like an entire spectrum of diseases. But when you are solving questions, sometimes you get confused between what is belonging to what. Okay, so take 2 days for rheumatology also and pay special attention to solving questions. Solve questions and again go back and study that subject. First time I say when you are solving questions, keep your book in front of you. Look at the question, glance through your notes and answer the question. That way you have to do it. Otherwise, just try to answer the question. Before going to the second question, read about this. Suppose you're doing a question on Sjogren's syndrome. The answer is Sjogren's syndrome. Open Sjogren's syndrome and read that. You're doing a question on rheumatoid arthritis. Solve that question, read rheumatoid arthritis and go. This way the first 10 questions will take you a lot of time because you're solving and reading. But after 10 questions, you will be able to answer them very easily and quickly. Okay. So do that for rheumatology. Then come to respiratory system. For respiratory also I am giving you 2 days because when you are doing respiratory, again it's very important that you revise physio and path. Because here also we are again learning about obstructive diseases, restrictive diseases and all. So doing them from physiology is very effective. First do physio, go through a little bit of path also and then come to medicine. It will feel as if there is nothing new to learn in medicine, okay? So that way that will help. Do respi for 2 days. Then move to CVS. Take 5 days for CVS because I know CVS in medicine is very big. You have to understand ECG changes, you have to understand so many disorders and not much of disorders are covered in physio and path also. In path, CVS is very simple. You're just looking at those atherosclerotic changes, vascular injuries and all. But doing it in medicine is completely new. You have to study about rheumatic heart disease, infective endocarditis, all those stenosis, mitral stenosis, valvular diseases, everything. There's a lot to be done in CVS in medicine. So take 5 full days to do CVS from medicine. Then come to CNS. When you are doing neuro part in medicine, take 6 days. And when I say 6 days, what I mean is, you will do 2 days of neuroanatomy, You will take 2 days to do CNS Physiology, and then the last 2 days you will do the medicine part. Pay a lot of attention to stroke and all other things. Things will become easy when you do neuroanat and physio, because you have now a good clear understanding about all the tracts. You already know all the Brodmann's areas, and you know so many things. You know the receptors, you know the blood supply of brain. All this will make studying medicine very easy. Alright, so you will do neuroanatomy for 6 days, 2, 2, 2. And then on the last 2 days, you will do renal plus acid-base disorders. Acid-base disorders are closely related to renal medicine, so doing them together will save time. Renal medicine is important but easy, okay? You have to learn those Gitelmans, Barters and all those. If needed, once quickly go through physio again. You have already completed physio just recently while doing pharmacology. So that memory will still be there, because after pharma you did a little bit of ortho and ophthal and you're coming to medicine. So you can still recollect that part, okay? So with this entire schedule, we have actually given how many days for medicine? 22 days for doing medicine. Alright, this might seem huge, but it is necessary, and please remember, you're doing so much of physio, you're doing so much of path and anatomy also. You're doing 2 days for neuroanat in these 22 days. Now, how much of anat did we complete so far? We are doing neuroanatomy with medicine. Head and neck we did after ENT. Upper limb and lower limb we did with orthopedics. Head and neck plus thorax also we completed with ENT itself. You're done with entire anatomy, yes, without even realizing it, and you're doing it wherever it's relevant and wherever it's important. And by here, you're almost done with physio also. Yeah, physio and path also. Physio, see, I'll tell you how physiology is already completed. What all did we leave in physiology? CNS, CVS, RSP. I'll tell you where each of them is done. In medicine itself, you have done endocrinology, you have done respiratory, you have done 2 days for CNS physio, right? So CNS, endocrine and respi part is done while doing medicine. I'll put a tick mark so that you will feel satisfied that we actually did them. So we completed CNS, respiratory and endocrinology while doing medicine. Let us see where the others are also done. While you're doing pathology, here also we did respi. So respiratory we are doing with both medicine and pathology, and GIT and hepatology physio part also we did here. So these two are also done. GIT you are doing along with path, okay. And now let's look at pharmacology. While doing pharma we did CVS physio and renal physio also we completed, yes. So CVS is done along with pharma and renal is also done along with pharma. Reproduction you will anyhow do with OBG, right? While doing OBG you will do repro. And hemat also is done along with path, yes. I told you the first day of doing path, you will do hematology, 2 days physio plus RBCs of everything, right? So this way unknowingly and integratedly we have completed entire physiology. So are you satisfied that everything in physiology is completed? Yes, okay. Now we have come so far till medicine, and we also completed medicine. Now after doing something as heavy as medicine and almost entire anat is also done, let us complete the other part in anat, which is embryology, okay. Do embryology for 1 day, just 1 day. 1 day. After doing embryology, then let us move on to pediatrics. Now this will also give you an edge, this type of doing embryology followed by pediatrics. Why? When you're studying CVS disorders, congenital cardiovascular disorders and all, understanding the embryology will give you an edge, okay. So first in pediatrics, do neonatology. Neonatology, I can tell you, is the most important part of pediatrics. So do it for 2 days. Then do systemic pediatrics for 2 days. and then do all the others. What do I mean by others? You have nutrition, growth and development, torch infections, congenital infections and some genetic disorders. All of them on the last day. Take 1 day to do this. And needless to say, when you're doing nutrition, you have to revise SPM part also. Kwashiorkor, marasmus, everything, revise the nutrition part and SPM also. If possible, revise biochem also. Okay. This way we have given 5 days to do pediatrics, and you're also doing some revision here. Alright, and then finally let us come to surgery. Surgery first begin with endo here also. Just like medicine, surgery also do endocrinology on the first day plus breast. These two can be completed on day 1. When I say endocrinology, most important is thyroid only. Thyroid surgeries are important, and then do breast. Then do urology. You will do all the renal disorders, kidney stones and diseases pertaining to testis. The entire male genital system plus kidneys, renal part will come here. So take 2 days to do that. And then do trauma. Trauma for 1 whole day, because trauma is very, very important. It's impossible to have a paper without questions from trauma. Okay. So spend good amount of time on that. And then do vascular surgery for 1 day. You will have disorders like thrombophlebitis, Berger's disease and all of them here. So do vascular surgery for 1 day. Along with vascular surgery, you also have to do head and neck. Do both of them for 1 day and then come to GIT. Now GIT in surgery is also very, very huge, just like path. Medicine GIT is small, but path and surgery part, it's very, very big. Okay. So when you're doing GIT, what you have to do is, remember we have not done abdomen and pelvis in anatomy. You have to do it now here. So you will take 2 days to do anat here, and surgery part 3 days. 2 days you will study abdomen and pelvis from anat, and 3 days you will do surgery. So all in all, we have given 5 days. When I say GIT, I also mean you have to complete hernia. Okay. So take 5 days to do that, and then on the last day do general surgery. Take 2 days to do general surgery, not just 1 day. In general surgery, what I mean, you have to do all your plastic surgeries, wound management, neuro part, bariatric part, everything that has been left out. General surgery plus miscellaneous. Now the most important part that you will be doing on this day is shock. Shock is very, very important. Okay. With this, we complete surgery. How many days have we given for surgery in total? 12 days. In 12 days, actually, 2 days is being taken by anat. With this, you're completing surgery also. And then after surgery, again give 1 day for anat. What you're doing now is histology. Histology plus general anatomy. About types of joints and all. There will be a few questions asked sometimes. Directly start doing questions and then go back and learn. Retrograde learning is important. So here, by the time you are here in anatomy, you have completed the entire gross anatomy. Yes, head and neck plus thorax with ENT, neuroanatomy with medicine, upper limb, lower limb with orthopedics, abdomen and pelvis with surgery. Embryology you did just before pediatrics, and now you are doing histology and general anatomy. You have completed anatomy with this. So everything that seemed to have been left out are actually done by the end. Okay. Then on the last 3 days you can do radiology. Doing radiology at the end, I am telling you, is very, very beneficial. Because by now you know all the systems. Look, and you have studied radiological images while doing them also. It's not like they say do it in radiology and leave that part. No, while doing surgery also you look at those images, right? While doing every subject you will look at a few important radiological images and you will see all of them in radio again. That will be like a wonderful revision. Okay. So take 3 days to do radiology. First day you will do the basic radiology stuff, and then on you will move to various diseases of radiology. So this completes our entire 19 subjects. Okay? And all this so far has taken 130 days. All 19 subjects have taken you 130 days. You're doing it so much in detail and you're doing it from the scratch for the first time, I'm assuming. Plus, here and there you're revising other subjects also. Now, physio, when you have done it so much in bits and pieces, further revision is actually not required. You only have to revise general physio and nerve muscle, because the rest of it you have been doing it every time, right? So, 130 days beginning from July 20. I am assuming you will start this timetable on July 20, 2023 plus 130 days. Where will we be? November 30. I am assuming only 30 days per month. August, September, October, November, 30 into 4, 120 days plus 10 days in July. You are actually getting 3 more extra days. July has 31 days, August has 31 days, October has 31 days. Those 3 days are for any miscellaneous gaps that will anyhow occur. You might fall sick or you might take a day off. Do not plan these 3 days in the schedule. Assume there are no gaps and go on, but by the end these 3 days will come into use for you. Okay. So by November 30, you have completed all 19 subjects in an integrated manner. By this time, you will also get the exact date of your NEET PG, and that will help you revise, plan your revision better. But still, I have given one revision plan that can be done in the last 1 month, that is in December. This is what you're doing in December. You will take 3 days for each set, and I will tell you how to revise. First, you will start with anatomy plus orthopedics. Now, I am arranging in such a way that you are doing one major subject and one minor subject, okay? And you will take 3 days to do this. Then you will do pharma along with anesthesia. 3 days. 3 days for each set, okay? You will do microbiology with dermatology. Then you will do OBG plus peds. Then surgery along with radiology. Then pathology plus ENT. SPM plus FMT. Now I am basically putting one major subject and one minor subject. Physiology plus ophthalmology. Okay. Biochem plus psychiatry. In medicine, you will do it alone. 3 days for all of them. Now this you need not follow this order, okay? Follow the combination as much as possible, because doing anat and ortho helps. Doing pharma and anesthesia helps because both of them have drugs. Doing OBG and peds helps because there is some overlap. So try to follow the combination, but order you can jumble and do the way you like, because by now you have already done that integrated revision. Now you can do whichever way you want. You can do path and ENT first and or physio and ophthalm first. It's absolutely up to you. But take 3 days for each combination, and 3 into 10, this will be done in 30 days. By December 30, you will complete one entire set of studying plus one revision. And I don't assume the exam will be on Jan 1st. You will have a few days in Jan also left. That will be for your final revision. Okay. So by December 30, you're done with a round of studying plus one round of revision that has been very, very effective. December 31st and Jan 1st, you will celebrate for all this achievement. This is a complete detailed study planner that anybody can give you. It's almost, I've assumed I'm myself studying and written this, taking enough time for each of them, and most of them have actually been tried. I've seen students study a subject and then I've put how many days it's taking, and I've put them quite liberally, you know, putting a little extra itself. Always, if somebody is taking 10 days to do pathology, I've put 12 days. Always with that buffer, I've put. So it's quite doable and possible. Please use this study planner effectively and follow it. Now, there are a few more very, very important things that I want to tell you. Now, certain subjects have certain special requirements. What they are when you're doing anatomy, from whatever resource you're doing, it's essential that you keep an atlas beside you. If possible, keep Gray's Anatomy plus an atlas, at least a soft copy. Now, I know you have all given up on books the moment you came into NEET PG preparation. You're mostly following the notes given by your coaching platform or some other notes that you have made, but you're not going back to your textbooks. But anatomy has that requirement, at least for pictures. Not at least, only for pictures. You need to follow and look at the pictures from a standard textbook, and that really helps. So that is the requirement for anatomy. What you have to do is either keep Gray's Anatomy or any standard atlas and look at the pictures. You're studying upper limb, look at the pictures. You're studying abdomen, look at the pictures. That will help you immensely. Take it from me, just trust the advice and go forward, okay? And other special requirements for some other subjects are, when you're doing biochem, sticky notes are a must. Sticky notes for glycogen storage disorders, lysosomal storage disorders, amino acid disorders, all of them you must have it stuck on your study table, okay? This is the special requirement for biochem. Next, for pathology, looking at the images of histopath. The histopath images are a must. You have to adopt your eyes to the world of pink and blue and be able to identify. Because in a question of pathology, how much ever you're good with the subject, without being able to understand the image, it's next to impossible to answer the question in an MCQ exam, okay? So make sure you're well acquainted with the histopathological images of pathology. Coming to microbiology also, it's essential that you're well versed with the images. Alright, then pharmacology also has one very specific need, and that is periodic revision plus memory hacks. Even if you're a conceptual learner, without memory hacks, it's impossible to cross the ocean of pharmacology. So make mnemonics, make stories, make threads, whatever, and you must have some memory hacks to cross the ocean of pharmacology. So these are some special requirements for these few subjects. Memory hacks for pharma are very important, and keeping your textbooks for images in anatomy is also very, very important. So these are the special needs, and I've already told you that following that particular order of subjects and topics within the subject is very, very important. Another few things that I want to share with you are, you must have a proper daily schedule. So what time you're going to do what, it's not for me to tell, because there are a few early birds and there are a few night owls. It's absolutely up to you. But this basic plan I can give you. The number of hours to study, the number of hours for MCQ solving, and the number of hours for revision. And your sleep hours will be constant throughout. I'll tell you how. In the month of July, you're studying for 5 hours. You're doing physio, ENT, head and neck and thorax anatomy, all that, okay? So 5 hours you have to study to complete all those targets. Do MCQs for 2 hours, revise for 1 hour, and sleep for 7 to 8 hours is a must all through your PG journey. Because all the part that you're studying during the day is getting integrated into your memory only when you're sleeping. So even if you're an insomniac person, you have to sleep for 7 to 8 hours, okay? Then coming to August. When you come to August, you're slowly settling down in your studies. So you can improve this 5 to 6 hours. MCQ solving will be for 2 hours only, and revision for 1 hour. You're studying for 9 hours here, and sleep of course for 7 to 8 hours. By the time you come to September, you will continue to study for 6 hours. You will solve MCQs for 2 hours, but you will increase your revision time to 1.5 hours. Because here, Whenever we are doing a fresh subject, mostly we are integrating it with some subjects that we are already done. So your revision time will increase. 1.5 hours is required for revision in September. So 6, 7, 8, 9.5 hours you're studying now. And then when you come to October and November, it's going to be more or less constant. You will study for 6 hours, do MCQs for 2 hours and revise for 1.5 hours. This is going to be same from September onwards. 9.5 is the maximum I'm asking you to stretch. Beyond 9.5 is actually not required, and it's very much possible to meet all your targets in these hours if you do effectively. During revision, it's up to you. 10 hours, 12 hours, 20 hours, 40 hours. Absolutely up to you. But how you utilize from July to November will decide how peaceful you're going to be in December and January just before the exam. So these months, according to me, are very, very crucial. By the time you're into revision, you will actually become serious and you will have a hold of things. You will know where you're weak, where you're strong, everything, and you can yourself navigate your way. You more or less do not require advices or any strategy videos like this, okay? So this is going to be your daily schedule. And when I say revision, what I mean is, for 3 days in a week, you will only revise images. And for the other 4 days, you will revise the subject that you have been learning. Okay? Because images require constant revision and there is no way to remember an image except looking at it multiple times. So for 3 days, you're going to revise images and for the other 4 days, you're going to revise the subject that you have been learning. This is going to be your daily schedule, and a few other hacks that I can give you that will make your NEET PG preparation journey easy are: one is following Pomodoro technique. It's a time-tested technique followed by millions of people and it definitely works. Irrespective of your type of personality, Pomodoro works. And what is the most important part of Pomodoro? Suppose you have put your time limit as 25:5. That is, you're studying for 25 minutes and resting for 5 minutes. Like that, you will follow for 4 cycles and then take a longer gap. The most important part is, after 25 minutes, you have to stop whatever you're doing. Maximum, you can take a lag of 30 seconds to complete that sentence. And stop, close the book, close your eyes. And do rest for that 5 minutes. Now, everybody thinks the 25 minutes of focused work is important in Pomodoro. No, it is actually that 5 minutes of rest that you're taking is the most important part. Because we do not know when our mind is getting fatigued until the last drop of blood, they say, no? So, until that last part of energy, we do not realize that we are getting fatigued and we are not able to absorb what we are studying. So, we continue to study. And Pomodoro helps you to break that exhaustion and break that fatigue by offering you 5 minutes of rest after every 25 minutes. Plus, if you are in the middle of something and you stop it, that part will actually be lingering in your mind and there are chances that you will not forget it. So, do not think I will complete this part and then take rest. No, that will disturb your entire cycles henceforth. Now, completion will take another 3 minutes and from there you will take 5 minutes. So, the next cycle is also disturbed. Do not do that. 25 minutes maximum leverage you can take is 30 seconds to just complete that line where you are in and rest for 5 minutes. What will you do in that 5 minutes is very, very important. Do not look at the screen. Do not even look at any book. Now, let me tell you 2 organs and organ systems that are going to suffer the most in this preparation journey are your eyes and your musculoskeletal system. So, please take care of both of them very nicely and properly. NEET PG journey will end in 6 months to 1 year, but those organ systems have to stay with you for the rest of your life and do not damage them for this exam. Not at all. It's not worth your eyes. It's not worth your musculoskeletal system. Okay. So, how you are going to take care of both of them? Now, unfortunately or fortunately, most of our education happens on a screen. So, our eyes are subjected to extra strain and extra pressure. Whenever you are taking a break, the rule is do not accommodate your eyes. Eyes, when they are in accommodation, require muscle power and energy because accommodation is an active process. So, make sure your gaze is at least 20 meters farther away. That will relax your eye muscles. And that's why I'm saying do not even read anything because reading also requires you to accommodate. Look at a distance far away, just have a blank gaze, blank gaze towards something very far, and also blink frequently. In this 5 minutes gap of Pomodoro that you're taking, at least for every 2 sessions, follow this in 1 session. Look at a distance and blink a lot. These two things are actually enough to protect your eye health. Do not look at a screen, please. Do not even read anything. Make sure your eyes are not accommodated. Now, some people have actually told me that they study in small cubicles where looking at a distance is also not possible. Now, in such situations, close your eyes. Closing the eyes is even better than even looking at a distance. Now, I hope closing your eyes for 5 minutes will not put you to sleep. If you have that problem, think of another third solution. If closing your eyes for 5 minutes can put you to sleep, do something else. First is do a long distance gaze and blink, or if that's not possible, close your eyes, or if that is also not possible, come out and do some walking wherever you can find some space to relax your eyes. And taking care of your musculoskeletal system is also very, very important in terms of the position. Now, until so far in those years of MBBS, we have not studied so intensely for so many days. We study intensely before our exams, but that is maximum for a period of 1 to 1.5 months. Here you are studying for 7 to 8 months with complete intensity. So it's essential that you maintain a proper posture. No slouching, no strain on your neck. The two most important parts that you have to take care are your neck and your lower back. So maintain a proper posture. It's very important. Not only it will set you discipline and give you a proper, focused behavior, it will also help your health. Neck and lower back. If necessary, exercise every day. Do some small neck exercises. Do some small lower back exercises, but do not put them at risk. Okay. This is important. Pomodoro and taking care of your health. Another small tip that I can give you is visual enhancement of your preparation. What I would do is take 19 Jenga blocks or some toys and put them one on the other. Stack them all together. 19, you can put 10 major subjects as one block and 9 minor subjects as another block. And every time you complete a subject, take this block from this side and put it on the other side of the table. Just looking at that will motivate you in 2 ways. One is when you look at that entire stack in between, it will feel as if all those 19 subjects are sitting on your head as weight. And slowly, when they are transferred from one side to the other side, you will find a sense of relief and satisfaction that you're completing these subjects and they're being done. Another important thing is making of notes. Now, it's absolutely individualistic as to your whether you're going to follow printed notes or going to write your own notes. But what I can suggest is follow color coding for 2 things. One is previous year questions and second is by heart. Now, in every subject, there will be a few points that just have to be by hearted and they have to be memorized again and again. So, when you find such things, suppose the IPC numbers in forensic medicine and enzymes in biochemistry and a few other things like that, few numericals in, surgery, all those criteria tables and all, they just have to be memorized. So, therefore, take one color, decide upon one color in the beginning itself, and whenever you find stuff like that, write by heart on that page. This helps you when you're revising. You will stop whenever you see that by heart symbol and read that again and again. And for PYQs also, keep a dedicated color and every time you see a PYQ, mark that there. This is ideally how you're supposed to do PYQs. When you're solving them, you have to open your book and mark it there as PYQ. Do not use these 2 colors for anything else. One color for PYQ and one color for by heart. These 2 codes you have to use and do not use these colors for any other highlighting or marking. Okay. This is one important thing. And about resources. Now, please do not ask me about resources because it's not that I cannot recommend. My favorite teacher could not be your favorite teacher. Even if you ask 100 people about which faculty is best for which subject, ultimately what is going to work for you, only you can decide. Now, we are still in the second week of July. The July 20 is the date when you're starting your preparation. So, these days I have some work for you to do. The most important one is deciding your resources. And your resource could be different for each subject. Although it is a little difficult, it is still possible. When you're studying anatomy, Start with one resource. You can actually figure it out by studying 5 to 10 pages if you are comfortable with that teacher and that type of notes. Like that, decide your resource for all 19 subjects. And please do that hard work by yourself. As I've earlier told, asking any number of people will not help, because to which teacher you can tune in, only you know best. So decide your resources. And another thing that you have to go and do is buy some stationery. Buy please 19 separate books for 19 subjects, and buy nice color pens and highlighters. As I told you, 2 colors. One for PYQs, one for by heart, and the rest of the colors you can use to highlight and write your notes. Another important thing that you have to do before you start your preparation is, because we are doing certain subjects in bits and pieces, make a contents list. You can write that on a paper, or you can take a printout of that. Write anatomy and write all the topics that you have to do. Write physiology and write all the topics that you have to do. You can use this list, and you can use the other list from your notes also, but write all of them in one place, and every time you're done with that, please put a tick mark. That way you will know what is done and what is not done, because we are doing, say, physio in different parts. So sometimes you will forget what you did and what you did not do. So please write a contents list and keep before you start your preparation journey. So this is all from my side. You have got a detailed study planner, you have got some tips and tricks, and also let me give you a few forewarnings. I'm not trying to scare you, but these things will eventually happen. To begin with, you might find this entire journey very, very overwhelming to do 19 subjects and so much of content, but please, that enthusiasm will make you study, will make you start at least. Midway through, there might be periods where you feel all this is just going waste, you do not remember what you have studied, and you are not able to follow and stick to the schedule. And sometimes you feel there are so many distractions about the date of the exam and all. You feel this schedule is not, this schedule or any schedule that you make for that matter, is either being too strict or too liberal. Sometimes you feel you will not be able to catch up to the exam date if you do it this slowly, or sometimes you feel there is not adequate time for each subject. Please ignore all of them. Stick to your original timetable as far as possible, unless it's completely shattered and broken and impossible to follow. Stick to the original timetable. And the original timetable that you make also, if it is self-made by you, sometimes it's possible that you overestimate or underestimate yourself. So make timetable only for the first 1.5 to 2 months. If you are able to follow that, then continue making. If it's a ready-made timetable like how I've given that you're following, you can follow it till the end. Okay. So there will be periods of frustration, anxiety, over happiness. You have to go through all that. NEET PG preparation journey is not just revision of all 19 subjects in the entire MBBS syllabus. It's also going to make you emotionally and mentally strong. Please remember, nobody can be a master in all 19 subjects. All you have to do is do all of them reasonably and go through the exam. And I cannot stress the importance of previous year questions. You have to start your subject by going through the previous year questions and complete the subject by completing all previous year questions. And MCQ practice is of utmost importance. So wishing you all the very, very best. You're going to start on July 20 and complete on December 30th. Take it as a penance. Take it as the best thing that you're going to do in your life, and you will reap the fruits for sure. Best wishes from me to you. Wishing you most and more. Take care. Bye-bye.